begin. I'm going to be your student nurse. Can I just begin by getting your name and date of birth, please? Okay, and it checks out, matches on your wristband. And so today we're just going to be doing a cardiac and peripheral vascular assessment. So I'm just going to begin by asking you a couple questions. So have you had any chest pain lately? No? Okay. Have you had any swelling in your lower extremities? And have you had any shortness of breath? Okay, so first I'm just gonna inspect for jugular vein distension. So she'll be at a 45. I'm gonna stand on her right side and have her look left. And no JVD is noted. I'm also, while I'm here, just gonna look at her general color and appearance, and for her ethnicity, her skin color is normal. It looks like she's perfusing well. Now I'm just gonna palpate carotid pulses, and we're gonna do one at a time. So I'm gonna palpate this one, and then this one, and then I'm gonna assess for bruits. So I'm gonna listen with the bell of my stethoscope.
So now I'm going to feel for the carotid, one at a time.
Okay. Now I'm gonna move down to her chest, and so I'm just like looking, and there's no abnormal pulsations. I'm now gonna palpate her radial pulse, or her apical pulse, and that feels good. And then now I'm gonna check for thrills and heaves.
No turbulent blood flow, no burpees.
And none of those are present. Now I'm going to listen at the 5 different spots here.
I'm going to feel for abnormal pulsations. No thrills or heaves. Listen to the chest.
Then I'm going to do the same spots but with the bell. Okay, now I'm going to move on to your arms. So I'm just going to check the pulses, the radial pulses bilaterally. And those are of normal amplitude and rhythm. And then I'm also just going to check her capillary refill. That is less than 2 seconds. I'm going to move down to her lower extremities. And here I'm looking at color once again, and no venous stasis or arterial stasis or arterial problems. And then now I'm just going to check for edema, any swellings. Bilaterally, no edema, no pitting. And then I'm going to check pulses bilaterally. So I'm going to start with the dorsalis pedis pulse. Those are strong and equal. And then the posterior tibial. And those are also strong and equal. That's all I have for you, Millie. Do you have any questions? Okay, thank you.